Today we're here with Mr. Edmond Haronian of the Edmond Haronian Insurance and Financial Services, Inc. Edmond, what do you think about the new revelations in Obama's healthcare?
The result of the
At the end of what?
At the end of all the up and down and arguments and the politics and who's better, who's not, which is right now, that's truly the argument. It's not the healthcare reform anymore. Right now it's the politics of who can do better and who is more in control. And really, the whole idea started with the healthcare reform, but now is the power struggle.
So you don't think it's about insurance anymore? It's just
right
a matter
now it's
of...
not about insurance anymore. It's about the power struggle. It's the Republicans say you are not worthy enough to do a reform, and Democrats say that if you don't pull anything off, we are going to lose big time our leverage. And that's what it is right now, unfortunately. Instead of the two parties putting their heads together and coming about of doing something constructive for the public, they are fighting to see who's better, which is unfortunate.
Well, how do you think this is going to sway?
I think at the end they will do some reform, not major, because their mind and thoughts are not together. In order to make a complete, healthcare reform, the whole Congress and House and the President and the Speaker, they have to go about doing the right thing, not what I like to do and what I want to do. So it's not about that. It's about doing what's right for the public.
And what's right for your clientele?
What's right for the clientele is basically to make some changes, which we feel would be extremely important. Removing the pre-existing condition issues for the people who want to get coverage and cannot. And that will require mandating health insurance also, which we feel it's
So, other words, in plain English, what do you recommend your clients?
Everybody has to have insurance. I think the rates should be more affordable. Absolutely, definitely, because it's not affordable for certain segments, especially families and middle-aged people. It's unaffordable. So hopefully by reducing the fraud, malpractice charges, just lawsuits, frivolous lawsuits, those are the aspects that has to be dealt with.
Right, of course the politics is going to take care of that, but
See, the problem is the politics does not allow this to go forward. But we hope that at the end the politician would put their differences aside and take a step at a time and make the right choices. But whatever it is, within the next month or two, we will have a clear idea what's going to happen.
Okay. Do you recommend people calling you to get familiar with what their choices are, or how important it is for people to call and find out about their choices before something passes and they would be stuck in a situation that they cannot escape at that time?
The more informed you are, obviously, the better. What really matters right now is that there are a lot of different plans. There are affordable plans. They can put together the right plans for people, and we can help people to get familiar with what's available. And the main thing is for everybody to be covered, and we have the tools to do that.
Okay.
Regardless of any reform, long-term reform or not, it's important to know that there is a lot of tools available.
I've heard that there is a possibility that if the Obama healthcare passes, that insurance carriers are not going to be able to issue new plans as they're able to do right now, and things are going to go...
Well, that's one theory. It may not. So we like to take the situation as it is right now and deal with it, and tomorrow is another day, and we hope for the best.
Okay, well, thank you very much for this unpracticed little piece of advice, and we'll look forward to your wisdom
Next one.
again.
Thank you.
Bye.